Can you imagine going to the dentist for a relatively minor problem with your jaw and winding up unable to speak properly for the rest of your life? Hi, I'm Mitch Berzon, a medical malpractice and personal injury attorney practicing here in Long Island. Over the next few minutes, I'd like to share a story with you that contains some valuable information about protecting yourself and your family when having dental work performed. The problems in this case started shortly after the plaintiff, a 43-year-old office manager here on the island, has a splint installed in her jaw. Several days after the procedure, the plaintiff calls a dentist who had performed the procedure, complaining of intensifying and excruciating pain where the splint was installed. The dentist, who was on vacation at this point, told her there was nothing wrong, don't worry about it, and when she called back the next day reporting the pain was even worse, she was prescribed painkillers. There was no referral to a specialist or another dentist or a hospital, and no attempt made to examine her despite reports of intensifying pain. 2 days later, on Christmas Eve no less, the plaintiff had finally had enough and went to another dentist on her own. The dentist quickly diagnosed an infection in her jaw, and despite immediately beginning courses of broad-based oral and IV antibiotics, the infection had taken hold at this point and was irreversible. The plaintiff ended up spending more than a week in a hospital where multiple surgical procedures were performed to remove the infected tissue and repair damage to bone and soft tissue that the infection had caused. If the infection had been found sooner, such as when the intensifying pain was first reported to the original dentist, there was a strong likelihood that a simple course of antibiotics would have cleared up the infection and prevented any long-term problems. The delay in identifying an infection means much more extensive treatment necessary, and the plaintiff in this case was left with permanent damage to her jaw structure and to the nerves that control the jaw function. She can't even open her mouth 2 full centimeters at this point, giving her problems both with speech as well as basic comfort and quality of life. After years of fighting, a jury awarded the plaintiff $3 million, compensating her for her lost wages, her medical costs, her pain and suffering. So what's important to take away from this particular case? Whenever you feel that you aren't receiving the care you need, or that your health is not returning as it should following a procedure, find a doctor, or in this case a dentist, who will actually listen to you. Delaying treatment can create real and permanent damage. And in the unfortunate event that you or a loved one does experience harm, make sure you hire an attorney who's dedicated to seeing your case through. If you have any questions regarding your own situation, or if you would simply like more information about your rights when it comes to medical malpractice, I invite you to take a look at our website, www.bsb-lawyers.com, where you can request a free copy of my book, Our Best Guide to Handling Your Personal Injury or Medical Malpractice Case. You can also call our office anytime. Speak to our staff, 631-265-6300. We'll give you the book. We help people like you every day. That's why we're here. Again, this is Mitch Berzon. Thanks for listening.